And obviously, ultimately, our goal is to prevent escalation or prevent admission to hospitals. But of course, we know that happens sometimes, and it's necessary. So we may be part of supporting and facilitating that where it is. An interesting part of I did touch on it earlier about what we are seeing more increasingly is perhaps people presenting with medically unexplained presentations, or what we call functional presentations. So you often see that with seizures, tics, Tourette's, where they look like what they say, the label that they have, but actually all neurological or all physical cause has been ruled out, and actually it's felt that it's probably becoming from a place of high levels of stress or high levels of anxiety, and that's the body's way of exhibiting that. So we call it psychogenic. So we're seeing an increasing amount of that. So as you can imagine, based on what I've said, really CAMHS crisis and liaison sees a huge variety of conditions and presentations. And it's really interesting, and really in terms of developing skills within nursing, it offers a massive variety. And I've talked a little bit about home treatment. So before I go on to talk a little bit about my nursing experience, I'll just see if there's any questions. So just to give you an idea, I mean, this is my nursing journey. Everybody's will be different, but this is mine. So I started training at Leeds University in 2000. Prior to that, I don't know if nursing was on my radar. So I did an apprenticeship as a mortgage advisor, and then I didn't want to do that. I went to do an apprenticeship in retail, realised soon enough I didn't want to do that. I think I just liked the idea of buying shoes. And then I decided I dropped out to do my A-levels. Academia at that time wasn't for me, and I became a support worker for people with dual diagnosis, so people with a learning disability and mental health problems, and I loved it. I felt I got a great sense of purpose out of it, and a little bit more direction. So I really enjoyed that, and I thought maybe I could do something with this. I had people in my family who were nurses, and also at that time, it was still being funded. And really what I wanted to do was go and have some life experience. So that's what I did. And I would probably say that it wasn't until the last 18 months of my training that I thought, oh, actually, I might be all right at this. And I quite enjoy it. And I did. And I had some wonderful experiences on placement, and worked with some really inspirational nurses. And particularly, I had a placement in youth offending, and it was a placement which I thought, oh, I can't imagine there being much nursing there. And I was just really surprised, and it kind of opened my perspective really about where nurses could be and how they can cross over so many different areas. And I liked that sense of freedom that maybe nursing could offer me. And I suppose what also youth offending that placement showed me is the high number of people with a learning disability or with autism that were represented in those areas. And it was the first time I started to be curious about more the social context, as they call it, epidemiology of nursing, why you find certain people in certain areas. So it was probably a pivotal time for me. So anyway, I completed my training in 2003. I worked in dual diagnosis acute inpatients. I suppose I call it that's where I cut my teeth. I had an absolutely formidable, she was a sister. I called her sister at the time. That's how I referred to her. That's how she wanted to be referred to. And she was, I suppose, inspirational and made me want to be that kind of nurse, not as in being fairly ruthless, but she was incredibly skilled, and had an impact on my career. So I suppose that inpatient experience for me is where I learned how to really engage people who are incredibly distressed or incredibly unwell. And then perhaps on the next day, when things were a bit more settled, engage with them again. And I suppose your ability to develop interpersonal skills really happens in a very concentrated way in inpatients. Somebody just put their microphone on silent. It's just a bit of background noise. Thank you. So yes, so I did that for a while, and then I have put this in because I think it's quite important. The lure of the private sector got me, and it will cross everybody's path. And it seemed more exciting, it's fancier, and it offered more money. And I went and did that for a period of time, and really it was for a number of years I did that. And really, what it highlighted to me is that actually there's not a patch on the NHS. And it made me see the value of being a nurse in the NHS in terms of that foundation and the infrastructure that's around you. However, it presented me with lots of challenges, and experience is experience at the end of the day. But I nevertheless returned to the NHS, and that's when I entered CAMHS. So prior to that, I was working in adult, came to CAMHS, and absolutely loved it. And again, recognising how things cross over. So I was a learning disability nurse, and really learning disability nursing is about thinking about development and lifespan, but really that developmental approach. And coming into CAMHS, working with children and family, you need to have the exact same perspective. You need to think about the developmental lifespan, how people followed the milestones as they should, what has interrupted those, what adverse life experiences have occurred in people's lives. And it kind of made a lot of sense to me. I could apply a lot of what I already knew and then enhance that knowledge further. So I had a wonderful experience in CAMHS. Around that time, I did some training. I trained in applied behavioural analysis and then CBT. And both of those remained quite fundamental to how I think about things. And it's really important that even though we think about mental health and psychiatry, really everything that we see, symptoms, interactions, it's behaviour. And we have to understand that. We have to understand the function of behaviour, what is it communicating, what's motivating and driving it. So always think about the basics, because they literally are that. They're your foundations. And then I went overseas, and I've worked in New Zealand, Australia and the Pacifics for about 8.5 years. I did some postgrad mental health training, became trained as an RMN whilst I was there, worked in a variety of settings. And for me, I was always one of those nurses that as soon as I was where I was working and I felt comfortable and confident, I thought about the next challenge, which is, okay, what part of nursing scares me? What do I not know about? What am I avoiding as a nurse? And I would go and place myself directly in that so that I could challenge that and develop that skill and knowledge. And I suppose my sense of being an all-round nurse. And I suppose stepping into adult community mental health, so being a traditional community psychiatric nurse, was really pivotal again in solidifying me as a nurse, realising that I could manage a caseload of 60. I could work in the community with families as well and with professionals. It taught me a lot of that nursing is not just about the direct care you give someone, it's about how you facilitate things for them, you coordinate, you bring other people in so that their world is a bit bigger than just you and them. And certainly in adult community mental health, you found a lot of people living in quite significant isolation. So you started to think of more of a psychosocial way of nursing, which is essential. So after that, my next challenge was crisis scares me. What happens there, and what happens when you have to make really quick decisions? So I went to work in all age crisis, and I became over there, which is called an AMP. So that's approved mental health worker. So in here, that would be. I think it's similar actually. It is an AMP, approved mental health worker. So you're part of Mental Health Act assessments and deciding whether somebody meets the criteria for being detained under the Mental Health Act and admitted to hospital. And I think for me, crisis, both with adults and here, I think you are so important in that moment, really, because you are invited, which is a great privilege, into somebody's life at the worst moment that they can imagine, and for their families as well. They're in dire straits, and what you do then to support and contain them is essential, it's valuable, it's a catalyst for what happens next. So it is a great privilege to be part of that. And also what it taught me is, I think I was always scared, well, what difference can you make at that point? You can make all the difference. And actually the kindest and most compassionate interactions can sometimes happen at people's most vulnerable. And I think that was a great lesson for me, that sometimes you don't have to provide something that's all singing or dancing. Sometimes you can listen to somebody, sometimes you can validate and offer compassion and understanding, and actually that sometimes is the most important intervention that you can provide. So after that, I decided I wanted something different again. There's a theme, and I decided to go and work on offshore refugee camps. At that time in Australasia, there was a lot of political and media related stuff around asylum seekers arriving in Australasia by boat. Some people were drowning at sea in their desperation to find kind of refuge. Let me just let someone else in. And it was an absolute kind of public crisis, really. And what was happening politically is people were not being allowed into the country, and instead they were being placed offshore in very poverty-stricken countries in these detention camps, awaiting their fate. And I felt compelled to go and try and be part of that. And I think it was probably the most ethically challenging part of my life in general, but also nursing career. But also what I saw, whilst devastating for me to see and for people to experience, was immense resilience in people who'd had the most harrowing of lives. And again, oh, can somebody just silence their mic, please? Thank you. And again, a great privilege to be allowed kind of into people's lives at those times. And again, the reminder for me was nursing sometimes is about being very human and making a human connection with somebody without the promises of anything, without expectation, just about being present with people. And so yes, that was a wonderful experience. And then I returned to the UK, which kind of brought me to this role. I joined the team as an agency nurse, became a band 6, and then beginning of COVID became the band 7 clinical team lead here. I think in terms of my practice, it is in trauma informed. It is utilising a lot of DBT within our service. Sorry, bear with me if there's a bit of background noise. And then in terms of the additional training I've added on there, and again, this is about the expansion of nursing. Don't think that you're pigeonholed at all, because you're absolutely not. There are so many strands that you can explore, which is what I love. And I still stand by the idea that nursing's a passport. So I've gone on to then do further training to do assessments of people with potentially with autism, so that you can offer that diagnosis, and to do the interview that's done with families and professionals to support that, and also training in liaison psychiatry. So CAMHS offers a wealth of opportunity, and there's a huge amount of investment going into CAMHS. And part of that is because they're kids, and actually they're at the part in their life where I think even the government realises that's where you can make a difference. So that gives you a bit of an idea of kind of my background, things I'm interested in, and and my journey. I'm just going to have a quick look at the questions. Thank you so much. Okay, Somia, so you've asked about apprenticeships. So I suppose there's a few routes in where potentially that can occur. So at the minute we're looking at apprenticeships for the nursing degree. So that's a recent development, and that's done through the Open University, and people who are employed here might be supported and funded in their current role. So often that is, we have a lady in our team, Megan, actually, who's doing one of the market stalls. She is a family support worker, wealth of experience, worked in CAMHS for such a long time, and in fact started off as an admin and has progressed her way through off her own back, incredibly dedicated. And we wanted to give back to her because we felt we really valued her and support her by going on to do her nursing training, so she'll stay in post here, she'll keep her job, and then she can have placements, but she'll qualify and come back to us. We'll retain her. So it's that idea of grow your own. So that's incredibly important. There are also the trainee nursing associate roles. Again, they're growing within CAMHS. You find that there's more of those within the inpatient sector, but I think that's something that will widen within CAMHS. Again, typically that would be offered to pre-existing staff members within the trust, perhaps who are working at healthcare assistant level, but no doubt there'll also be external advertisements for those, so things to keep your eye out for. Samia, can you touch on different ways to get into nursing and university if you don't necessarily have the grades? Of course. And actually, I feel very strongly about this because I didn't have the grades, I suppose, when I did it. I had GCSEs. I was lucky that I'd scraped enough to get my maths and science, but because I was not academic back in the day, I became academic later, but perhaps I didn't have the confidence when I was younger. So for me, I entered, and I think they still do have this route. So I had a bit of experience as a healthcare assistant anyway, so I was able to draw on that. But I wrote a personal statement, like an essay, and I talked a lot about my personal experience maybe with family members with mental health issues, my experience of working with people with a learning disability. And I suppose what I was able to do was reflect that I had a sense and an understanding of what caring is, and really caring is the basis of nursing, and that I thought about it and that I talked to people about it, and I kind of presented, I suppose, what was received as being very motivated and that I put thought into it. So I think people can do that. Also, obviously, as we know, there are the access courses that people can do where perhaps you need to you might not have the GCSEs or whatever. You could do an access course, which I think is a year, and then that can then move on for you to do your nurse training. So I hope that kind of answers that for you. Do you accept newly qualified nurses? So again, it's something that our service in particular has started to be more open-minded about, because it's about the workforce, and there is a limited workforce. Traditionally, crisis teams have always been about, oh, you need to have been a nurse for so many years before you come and work with us, but we're turning that on its head. And the idea that maybe we can grow our own with us, alongside us. So at the minute, ideally, what we're doing is we're identifying people who are maybe in the service on final placement or on final placement with us. So we know them and we know their capability, and then we can take them on as the new qualified Band 5 and do their preceptorship. But we have to be more open-minded than that at times, and we've just taken on 2 Band 5s recently in our last lot of recruitment. So it is absolutely a possibility, and certainly in other areas in CAMHS they'll look at that too. So I hope that I answered your question, Meaden. I hope I pronounced your name right. Is there a requirement to be an RMN to work in crisis? I've seen the trainee CYP wellbeing practitioner role in other locations. Is this something often in Nottingham? So 2 parts to that question. Do you have to be an RMN to work in crisis? No. So you could be a learning disability nurse. You could be a social worker. You could be an allied health professional. So as long as you can demonstrate perhaps your understanding of the role, then no, that there's not a hard and fast rule that you need to be an RMN. In terms of the trainee CYP wellbeing practitioner role, so you don't even have to be a registered health professional to apply for those trainee positions. The trainee CYP IAPT or wellbeing practitioner roles is linked to Reading University. So you might be a health support worker, you might be a psychology undergrad, things like that. And as long as you can demonstrate that you could maybe work to university level, then you can apply for those roles, no problem. You get put through your training. On completion of your training, you are then a qualified CYP wellbeing practitioner. However, the trick is, once you're that's what you are. You're not then a nurse, you're not then a social worker, if that makes sense. You are a CYP wellbeing practitioner, and they're the roles that you can only apply for. However, I am of the understanding that you can then do a top up for a year and perhaps, for example, go and do your CBT training. So there are options. So I hope that makes sense, Sam. Leah, I was wondering what the transition is like for LD nurses moving into CAMHS. Well, I'm prime example. It's easy. As I said before, Learning disability nurses, like any nurse, have transferable skills. You have a good understanding of developmental principles, which is essential to mental health. You have fantastic skills in communication and adapting your approach so that people understand what you mean, and so that you can support comprehension, which is essential in psychiatry, because we obviously will meet people in psychiatry who lack capacity or are not presenting the best that they can. So the transition for an LD nurse into CAMHS, I don't really see it as an issue, and I hope more LD nurses will join CAMHS, and not just to work in the ID service of CAMHS, but to work amongst CAMHS, because I'm all for that. We've all got valuable skills to share amongst each other. Okay, Karina, are there opportunities to work in community teams as a newly qualified nurse? Yes. I think, as I referenced before, again, it's looking for those opportunities, those band fives, but also where there are band sixes advertised, I would be ringing the people who are named on the job description, have a conversation with them, make yourself known, show your interest. Also, if you're just about to finish your nursing, again, make contacts with those teams now. If you're on your final placement, contact us about having insight days or an insight week, because we are more inclined to take newly qualified nurses if we have a sense of them, if we know them. But we're definitely going to be doing more of it. So I hope that answers your question. Where can you do this access course? I'll find that information out for you and pop it on. But I'm fairly sure you can do it through the local colleges, but I'll find out for you. Bear with me. Access to nursing. Oh, somebody's answered that question. Thanks, Susan. Would we need to do our maths and English along with it? So I don't know if you do, but it might be that they do some part of that access course. It kind of covers that actually you have sufficient maths and English. But obviously for nursing, there is a maths requirement, because you have to do medication calculations. So there is a need to try and make sure you meet the basic maths criteria. Okay. Oh, Susan's answering my questions for me. Thank you. IAPT question. I'm completing psychology master this summer. I've seen the trainee IAPT role in southern counties, but hardly anything in the Midlands. Also, I have no experience working with young people. Don't let that stop you. But would you suggest I try to get some voluntary experience? I mean, absolutely, get some voluntary experience. Register to work on Childline. Register to work for the Samaritans line as well. No problem at all. I would also suggest, I'll put a contact on here of a lady who kind of manages the IAPT stuff. Her name's Jenna, I think. I'll put, and perhaps you might want to ask her the question. But really, I wouldn't let a lack of experience stop you from applying. The reality is your psychology masters would have given you some theory-based information and experience around children, and then you're in a trainee post anyway, so you'll get that experience whilst you're on the job. I'll come back. I will put an email address on for that. Make myself a note. Okay. Okay, Samaya. And what vacancies do you have now? I'm studying level 2 diploma in health and social care. I wasn't successful through the access route at my college. Okay. So in terms of current vacancies, I think there will be a link put in here anyway. And this might be the same to answer your question, Grace. So currently there are, health support workers. So that is for the inpatient unit. Again, if you're new to kind of health, or you're new to CAMHS, that might be a really good starting point. And actually you could probably go in at level 2. And I think it's a brilliant way to get to meet young people who access CAMHS, interact with them, get to know how the system and how CAMHS works. So there are, let me check if there are current vacancies. It says on the list that there are current vacancies for healthcare assistants, so that absolutely would be an option. In terms of the other vacancies, now these would be level 3, band 3 positions, family support worker and peer support worker. So peer support worker may be less about needing the experience or a qualification, but it's more about life experience. It's an absolutely wonderful role. And if you get to go to the peer support work market stall, please do. You'll meet Saffron and Tracy Duke, both amazing ladies. Tracy worked in our team in crisis as a peer support worker. We currently have not filled it. So, and that's people who bring a level of life experience, whether it's through their own experience of CAMHS or mental health services, or whether it's through a family member. And Tracy would tell you herself that her daughter went through CAMHS and she had anxiety. She accessed CBT group. And so Tracy can talk about how that was as a parent to, not know how to support, your child when they were struggling their most, and how CAMHS made a difference in empowering her as a parent. So Tracy's work is pivotal in engaging parents. So peer support worker, I think it's band 3, so that's something to consider. And then family support worker, these are in the community CAMHS teams. They would require perhaps more experience and perhaps some training, because often it is that you are working with families, you're delivering a parenting intervention. And the intervention we primarily use in CAMHS is called NVR, non-violence resistance. The name does not really represent what it is. But of interest, it was developed in Israel by a paediatrician, I believe, and it's about avoiding conflict or managing conflict or not getting to the point of conflict, thinking about alternatives, and it's really powerful for parents, and that's something that we use heavily in CAMHS. So you would need either a little bit of knowledge about that or certainly be opening to doing that training. So they're the three vacancies which Grace and Somier I would be a suggestion you kind of look into. Okay, are there any recruit to train opportunities available for those who are experienced in CAMHS? Yes. So again, I don't know if there's any current vacancies, but they come around with the academic calendar. Okay, so you do keep an eye on those. So recruit to train. So we do that for CBT, we do that for systemic practice, we do it for the child and young people's kind of wellbeing practitioner. What else do we do it in? I think they're primarily it's those ones. So yes, do have a look for those. They should all be advertised as they do come up. What I will suggest, and I'm going to put all these emails on, is for people who want to have their hand in, I would be joining our bank, which is about where you might pick up the odd shift, even as a healthcare assistant, an unregistered member of staff. It kind of you're in the system then a little bit, and you get to know a bit more about these vacancies as they come up. Sam, I've just trained to be a shout volunteer. Would this be relevant? Yeah, absolutely, Sam. I think that's really relevant. So, and again, I don't really see that there would be a barrier for you applying for that training post with your psychology training as well. So yeah, go for it. Samia, where will the vacancies be posted? So in a moment, I think there's somebody kind of watching our workshop who will just put all the current vacancies on in a moment. And I think also they might have been in that original intro chat as well, that there's a link to them. Otherwise, they'll all be on the Nottinghamshire healthcare website under current vacancies. So do click on those and have a look. Cool. And yeah, I agree, Samia, you can absolutely work your way up. There's evidence of that in our team. So, and a lot of us, particularly a lot of the experienced nurses, we started off as healthcare assistants, and I think sometimes that's incredible experience to bring to your onward nursing career. Faye, do vacancies come up quite often? I'm a year 2 mental health student qualifying 2022. Yeah, absolutely. And at the minute, I kind of referenced it earlier about current funding. So there's a massive injection from the government about extending not just community CAMHS, inpatients, crisis services. So there's a massive recruitment drive now, but that's going to be ongoing because we can't develop each part of the service right now. It'll be done in stages. So you'll see waves of recruitment happening. But what I would say to Faye and anybody like Faye who's in year 2 of the mental health or any nurse mental health or ID nurse training, year 2 or year 3, contact us. I'm going to put the name of email of Deb Boyer on here. She manages placements within the trust, and that's for Nottinghamshire and Derbyshire student nurses. And so that's the person you should contact or get your uni to do that, to arrange placements, or I'm always happy to get an email as well. So I've put on there a few different emails. I'll put mine on as well. Bear with me and I'll come back to the questions. Okay, that's me. Right, let me go back, see what questions I've missed. Okay. So, Eleanor, I'm currently studying social work at uni. Is there a route into CAMHS at all? Yes, absolutely. I mean, really, as a social worker or allied professional, you could apply for majority of the... So unless it specifically says nurse, which will only be for very clinically related roles, but if it says CAMHS practitioner, crisis practitioner, that practitioner bit kind of means anybody as long as you've got a registered qualification. So absolutely, you can apply for any of those. Now, who is... I'll try and perhaps find out who the social work lead is. In fact, Eleanor, I'm going to put a name of a lady on. Bear with me, I need to get her email up. Who you could consider contacting. She is a consultant social worker. She works part-time in CAMHS and also part-time with the local authority, supporting newly qualified social workers. So she might be a really helpful contact for you. I'll come back to it. Okay. So nobody's got a hand up. Is there anybody who wants to ask a question that's not on the chat or not's been covered already? Otherwise, I'll talk for England. No? Okay. Just some questions that were asked in the morning session, which might be useful, are people asked about development opportunities for nurses. So there's lots. I mean, I talked about a few of them. So the opportunity to do further training, CBT, systemic practitioner, that kind of stuff. So that all those therapeutic additions are available to do training in. So what else is available in terms of the nursing pathway after a bit of experience is non-medical prescribing. There's quite a push for that because, as we know, the workforce for our doctors is very limited. So we supplement that with experienced nurses who can also prescribe. And we also are looking at the advanced clinical practitioner pathway. So again, that's a very advanced clinical nursing role. And so there's currently one in the trust. So Rebecca, put her email up there as well. She's also our CAMHS clinical director. So it's a senior role, but we've also have 2 trainee ACPs, that's the short name, and I'm going to do the same in September, hopefully. And the idea is that there'll be a few ACP roles covering the major areas of CAMHS, which is about providing really expertised clinical leadership. So there's lots of opportunities. Sam, yeah, let me get the email for the IAP lady. Bear with me. Okay. IAP trainee. So I put more than one on. Bear with me. Okay, there we go. Sam, apologies. That's Jenna. And so in those other emails that I've put on there for reference is so the nurse bank email. So those who are inquired about joining the bank, either as a registered member of staff or an unregistered at band 2 or 3 level, there's a contact for them. Those interested in placements, Deb Boyer, I put her email on there. Really, but ideally, one of your leads within the uni to contact her to request formal placements. And then Becky and Laurie I've put on there. So they're the leads for the education mental health team. So I think somebody asked about those trainee posts as well. So they're some contacts for you. Emma, just go back to your question. I'm a return to practice dual qualified nurse with lots of experience in CAMHS. Could I apply? Could I be applying for a band 6 job? I would say probably. I think again, it's about demonstrating in your application and in your interview that whilst you may have had a break from practice, about the skills and knowledge that you've retained. And it might be, you know, sometimes what we've done in similar situations is we've like, we can see that you probably are band 6, but maybe let's go for that developmental 5/6 post and just kind of get you refreshed and then into a 6. So I would absolutely apply for them. And again, the name that's at the bottom of those band 6 jobs, who will be the lead interviewer, ring them or email them and just get your interest kind of over to them. Do you ever have work placement opportunities or visits? Yes, Susan, we do. We can't facilitate loads, so we do be selective. So it depends where you're coming from. If you're already in CAMHS or you're already a student at the local unis, we're more probably able to support those visits. But there's never harm in asking. Okay, and if we can't facilitate it, we might signpost you to someone else that can. Faye, are there many CAMHS services within Bassetlaw? Yes, there are. So one of our community locality teams, which is called CAMHS North, they cover Bassetlaw as one of their areas. As a crisis team, we also cover Bassetlaw, so we do attend Bassetlaw A&E. We do consider it a remote site, so we're not as present, but we still offer that service. And generally, what we try and do is we link up with any existing services in Bassetlaw that might be providing services, and we kind of use them as signposting. But yeah, in terms of those who are attached to Bassetlaw would be CAMHS North, who cover Newark, Bassetlaw, so Newark and Sherwood, Bassetlaw, and I think that's it actually. But that area, those who border on Doncaster and Rotherham, essentially. Olivia Payne, does that email for IAP training cover the high intensity course as well? Yes, because then that would be, instead of the trainee CYP IAPT wellbeing practitioner, it would be the trainee CBT. To turn my phone down, CBT pathway. So yes, Olivia, and again, Jenna will give you more information. She's the link for Reading University, which is where all the IAPT stuff, the CYP, so that's Child and Young People's IAPT training, comes from. Arusa, do you know if there are any vacancies or apprenticeships for radiology imaging assistants? I don't know that information. I suppose you would be looking at Nottingham University Hospital for that. So that's the likes of Queen's Medical Centre or Sherwood Forest Hospital, which is Kings Mill, because that's not really obviously sitting within mental health services. So I would suggest perhaps going on Google and checking those out. Summer, from a healthcare assistant, can you work your way to a nurse? Also, can you give a prescription of what a healthcare assistant does? Yeah, you absolutely can. Many people have done it. It might take time, but it's obviously something that can happen. So in terms of what a healthcare assistant does, so you might, depends where it is. If you're on the ward, you might have people who have to have certain levels of observation and engagement, and maybe as a healthcare assistant, you're tasked with doing that. Make sure kind of people's self-care is supported with, kind of engaging in activities and interaction, maybe being a key worker for some young people, so you develop a bit of relationship, you do check-ins with them, that kind of thing. In terms of the community, you might go out alongside one of the registered members of staff to support. You will engage young people, you will engage families, you will do a lot of liaison with other professionals, so phoning social services, phoning schools, getting that information, maybe going to schools to visit. So it's very varied, really, and really you can do as much as you wish. You can make the role as big as you like, I suppose. The difference about healthcare assistants is it will be under the direction of a registered member of staff. Okay, Eleanor, what's the one for oh yes, you want that email, don't you? Bear with me. Okay. So again, with the last email, so Jenna, and then this one is Marianne. Again, if it's not exactly them, they'll know who it needs to be and they'll point you in the right direction. So I've popped her email on for you. Leah, in the crisis team in CAMHS community, how many people do you have on the caseload and how long do you work with people for? So very different. So in terms of the crisis team, so we'll have to split it up. So we've got a crisis team community, so crisis home treatment, and then crisis team liaison. So liaison goes to the hospitals, does the assessments in A&E. So really the minimum we do is that one assessment and one follow-up. That's the minimum. For some, where it's indicated and we would have conversations about that, we might do 3 to 4 sessions to prevent the need for onward referral either to crisis, to community, and where we can stabilise things and then kind of refer back to GP, for example, or we look at other supports like in school. In terms of crisis home treatment, again, it's variable. So, but really crisis home treatment's about that immediate acute assessment, stabilising kind of risk or mental health presentation, where it's indicated we could work for somebody up to 3 months, but that's not very often. We basically do what needs to be done to keep things safe, and we try and move people on to the right area or the right support because we're not an ongoing service. In terms of how many people on our caseload, I mean, it changes so frequently, as you can imagine. People might be on our caseload this week and next week they're gone. So roughly, on the crisis home treatment, we might have for the whole team 60. But again, it's dynamic. In terms of the liaison, we break it up. So Queen's Medical Centre, always our larger caseload. We might have 20 plus at a time, but it moves all the time. Kings Mill, slightly smaller. We might have 20. And Bassett Law, much smaller, like a minority. We might get 3 a month. So, but it varies. It's hard to kind of say. In terms of the community, again, depends which locality. If you're under CAMHS South, which is Gedling, Rushcliffe, Broxtowe, the caseload for the whole team could be nearing 900, 1,000. So how many of them people would have on a caseload, I don't know. I can't really talk to them, but obviously it's going to be different. You're holding a caseload to do a longer piece of work for a longer period of time. So that just kind of gives you a snapshot. Okay. So I think Grace, is there any placement vacancies for those that are still in college? Grace, do you mean college, like finishing like an access course or an MVQ or A levels? If you clarify that for me, I'll have a better idea for you. Obviously, age makes a difference because obviously we're a CAMHS service, so we do have to be mindful about that. Placement vacancies, I'm not sure. Trainee posts, we do take people kind of from college. So I just need for you to clarify with a bit more information. I might be able to give you a better answer. Okay, we got any hands up? No? Okay. So in terms of just going back to some of the stuff that was mentioned in the first workshop, which might be helpful in terms of when we think about nursing, don't get stuck on the idea that, you need to choose the right area of nursing to kind of access all these opportunities ahead of you. There's loads of transferable skills. And in fact, in CAMHS, we have a lot of nurses who are children's nurses or generally trained who perhaps have worked in school nursing and healthy family teams. So if there's evidence of transferable skill, then things are quite fluid. And particularly, for anyone who's out there as an ID nurse, you really have valuable experience, which applies to mental health, particularly in CAMHS. Don't be afraid of that. When we think about CAMHS, we always think about the idea that it's not just the kid that we're working with. It's not just that child. Children do not exist in isolation. They exist within an environment and they exist within a family, a system. And so you will work with the whole of that. And so sometimes that feels daunting, but it's absolutely essential that you put yourself in a position where you learn to develop skills with that, how to talk to people, how to have challenging conversations, how to educate people so that actually they're part of the therapeutic intervention for that young person. So it should not really rely on you as a professional, because actually that creates dependency. We want families and young people to have self-agency. We want them to manage their own lives, you know, and what we'll do is we'll impart support and skills for them to be able to do that. So sometimes you've got to think slightly differently as a nurse when you're in CAMHS. Sometimes you're more of a facilitator, which is how it should be, because we don't want young people to feel that they have to stay in CAMHS for forever. That wouldn't be a normal adolescence, would it? What else? So in terms of CAMHS, we always think family, so we mentioned that. We often think about trauma, developmental trauma, and you may have heard the term ACEs before, adverse childhood events. What we know is with young people who have had a number of adverse childhood events is that that results in poor outcomes for both health and mental health in later life. So this is why there's so much money going into CAMHS, because it's about reducing the number of people within adult mental health service with chronic conditions. So if we can do the intervention early, then we should. And when we think about adverse life childhood events, often those events have affected the whole family. So the work is for the whole family as well. Just checking my notes. I think they're my little tidbits. Let's have a look at the questions again. Grace, thank you for clarifying. So an access course to get more experience in doing level 3 diploma. I probably need to. What I'm going to do is I'm going to put an email address of a lady who will not mind answering that question. And it's Tracy, who I mentioned was previously our peer support worker, and she then went on to do the education mental health trainee practitioner role. And I wonder whether she might be able to give a bit more insight into what options are available to gain more experience or to get onto an access course, because I perhaps don't have up-to-date information on that. So bear with me and I'll get her email for you, Grace, or anyone else who wants to use it. I will tell her. Info on gaining experience and access course. There you go. Okay, so can you speak on different nurse roles like paediatric nurse? I can, but I'm not a paediatric nurse, so I can't necessarily tell you too much. So I suppose in terms of a paediatric, a children's nurse, it sits within that general nursing forum. So it is about physical health care. So it would be more medical in terms of procedure. So you'll be seeing people, you'll be seeing children more so on children's medical wards with medical conditions which you are treating. And even in the community, it would be about treating those conditions. So whilst there are paediatric nurses who over time have gained experience in different areas, which then lend themselves to CAMHS, their training is not fundamentally around mental health. It's about transferable skills. So that's kind of all. I don't really have experience in terms of paediatric nursing to offer you anymore. I'm just going to check our time. Okay, so marketplaces start in about about 6 minutes, 6-7 minutes. So are there any more questions that anyone has before you could perhaps have a little breather before you go on to the market stalls? Be happy to take any questions at all. And as I said, I did put my email on there as well. So if you do have any questions after today, please feel free to email me. I might not have the answer, but I will try my best or to pass you on to somebody else who does. But otherwise, thank you for listening. You're very quiet. Does anyone want to talk at all? Feel free. Okay. All righty. Well, thank you all very much. Thank you for listening and being attentive. I do apologise. I can talk once I get started. My email is up the top. If you scroll up, it is. I'll copy and paste it there for you. There you go. There it is. All righty. Okay, guys. Well, please go on to the market stalls. So in terms of, there is a CAMHS crisis market stall, and my colleague Amanda Foster is hosting that from 2:30. Amanda's our operational team lead, so you can pick her brain. There's also some other really interesting market stalls in terms of where I would be going. Children's looked after services, incredibly interesting. Obviously children who are in looked after services, and so really lots of thinking about trauma informed practice, which is really key at the moment in nursing, so go along to that. Head to Head, really interesting service that work with children with early interventions around early first episode psychosis, children with substance abuse difficulties, and also those who have come through the youth offending system. So again, really, really interesting stuff. And there is also a CYP IAPT market stall for those asking about that pathway and that trainee. So head on over to those. Okay. All right, everybody. Lovely to meet you, and thanks for asking lots of questions. And I'm going to close the group now. Okay. Bye.
Thank you.
Thank you. Bye.